Yes.
Okay. Thank you so much. Hello and a very good afternoon to respected guests and all the nurse participants of Bharti Hospital, Sangli, Pune and Navi Mumbai. I, Mrs. Nikita Bhandari, feels privileged to welcome you all for the Diabetes Educator Program for Nurses organized by BVDU College of Nursing, Sangli, Medical Surgical Nursing Department in collaboration with Eco India. So I'll be responsible for hosting this presentation today. But before we plunge into the agenda, I would like to extend a warm and heartfelt welcome to our distinguished guests. Firstly, I welcome Ms. Anila Goswami, Deputy General Manager of Eco India, and I request ma'am to say a few words.
Thank you so much, ma'am. Good afternoon, everyone, all the dignitaries, Nilima ma'am, Praveen sir, Yogesh sir, and all the hub team members and the coordinators from all the Bharatiya Vidyapit College of Nursing and dear participants. So it gives me immense pleasure to be a part of this initiative. I would like to congratulate and thank Dr. Nilima and the entire team for taking this initiative and the important topic of diabetic and to orient the nurses as diabetic educators and orient them how to act as a diabetic educator in an efficient way. So as you all know that diabetes is a growing challenge in India. It is estimated that WHO has estimated that 8.7% diabetic population in the age group of 20 and 70 years. That's the Indian scenario. And also, when you look at the National NCD Monitoring Survey, the diabetes prevalence in India was standing at 9.3 in 2018. It was 9.6% in 2021. Now it has been increased to 10.54. By 2030, it will be increased. That is the estimation. So now you understand, the prevalence of diabetes in India. And as nurses, as educators, counselors, and clinical nurses, we have an important role to play in the lives of people suffering with diabetes. So I'm sure this, program, one of the hub team member would be giving an overview of the program. What are the aims to, we intend to train all of you as diabetic nurse educators, and how do you handle the patients? How do you counsel the family? How do you encourage the patients to take their time? And also, when we hear that, the diabetic patient has, they get a lot of complications like diabetic foot, all sorts of activities and the sugar control, blood glucose monitoring. There's so many aspects, of a, as a part of the diabetic nurse educator when you take care of the patient and also, to the counseling of the family and the screening part, regular visits to the hospital, and also you act as a team between the doctor and the patient. You work as a catalyst, or like you bridge the gap between the patient and the doctor, and you play an important role as a diabetic nurse educator. So talking about Eco India, we are a not-for-profit organization. The ECHO stands for Extension for Community Healthcare Outcomes. So what we do is we do the capacity building of healthcare professionals through a telementoring platform. So all of you have joined using the IECO platform. The platform is called as IECO platform, which enables you to join the virtual learning. And what we do is we collaborate with the academic institutions like Bharatiya Vidyapit College of Nursing, or we have 28 national health missions across the country. We have onboarded with 19 All India Institute of Medical Sciences. We have 14 state nursing councils as partners with us, and also various associations. So they act as a center of excellence, they act as a knowledge partner, and they develop programs for all the healthcare professionals in India. What we do, we would like to bridge the gap between, the knowledge deficit, and using this virtual telemetry platform, we don't move the, people. So what happens, you all are sitting from various, hospitals, like you all are from the Bharati Vidyapit and Bhartiya, the associated hospitals from three, different areas from Maharashtra. So you all don't, you don't have to go to a place, get trained, so you all can join virtually, and using the platform, you are able to, interact with the expert. You are getting a live, session where you can clarify queries. You will get to learn from each other. What are the best practices, which are the institutes following, And also, your experts would be ready to give you recommendations. And another, when we talk about echo, I'm sure when during your spoke training, the echo colleagues must have trained you on and told about you the echo model. Echo model is an ABCD model. So A is amplifying resource. So that means now, like, we have connected on Zoom, as I mentioned, so we don't have that kind of activities, like, physical meetings where you need to have money, you need to have people, you need to take a leave to get trained. So there is a lot of resource activities happen. So by using, Zoom or the IACO platform, Zoom is inbuilt in this. When you see now, this is a Zoom meeting, but you have entered through a platform. So, where you don't have to, have, so this bridges that gap, and, you can, this is known as amplifying resource. B is, best practices. So while you all attend these sessions, all the subsequent sessions, you will understand, as a diabetic educator, what are the best practices you can learn from each other. That is one thing. And C is for case-based learning. So we will get to see, one of you are asked to present a case, from your real life scenario. So you will go back to your when, and I'm sure, it will make a huge difference in your learning and your clinical practices. So all these sessions with whatever they have thought of nicely, College of Nursing, your faculty, nursing academicians have well thought and well prepared these topics. And when you go back to clinical stage, you will remember what are, things you have learning from here. And also, how to handle the patient and the case presentations. You obviously can come back and you discuss your cases. For example, maybe the insulin titration or the glucose monitoring, all of a sudden, if the sugar goes up, what is the step and next nurse should take, even if you are not a certified nurse, diabetic nurse educator. But I'm sure, this course would, benefit you in terms of, more advanced knowledge, and also to act accordingly and take decisions. It will be, more decision making capacity you will have, after undergoing this program. And also you will have a lot of understanding about, so please be, prepared to come with this session. So have some understanding. You all have undergone, you all have good, good training in your nursing academic, activities. But now this is the time where you will upskill your knowledge. You will, refresh your knowledge and get to know about the diabetes and how to, practice like a, nurse, and who can educate the patient, who can help the patient, who can, help the patient to manage the diabetes. So as I was mentioning, till C is the case presentation stuff, and then the D comes. D is data. So, when you join this session, you can go back and see in the platform. You can fill up the feedback. You can see your attendance. Yesterday, you must have got the, training on our platform. So that is the model which ECHO, follows. This model helps, to bridge the gap between the, the care which is given at the primary care level, and you people, sitting are working at the clinical side, or academicians are training you. So by sitting and by attending the virtual programs, you're getting a knowledge. And also, I'm sure this program has a credit hours also. They are very thankful to the, college for reaching out the Maharashtra Nursing Council, and also thankful to Archana Bade ma'am and the officials at the Maharashtra Nursing Council to give you credit hours. So these programs will help you to improve your continuous nursing education. You have a credit hour and you improve your license. So this will help you to increase your employability skills as well. So this is all about the ECO model. So I would like to thank each one of you on behalf of ECO India's leadership, our Chairman Dr. Kumud Rai, our Executive Director Dr. Sunil Anand, our Chief Operating Officer Mr. Surojit Saturaj, our Vice President Dr. Sandeep Bhalla. I would like to, thank the entire Bharatiya Vidyapeeth College of Nursing, Sangli branch specially, and the other branches, and the team from, the dedicated team from Sangli College of Nursing, and the participants. So, wishing everyone a happy learning. And I would request each one of you to interact, because these sessions are to be, make it interactive. Ask your questions. There are chat box. This is a technology-driven platform. So you will have, some Zoom poll activities can be taken up, and you have breakout rooms. So, you can come up with a new innovative ideas also, and you can share your experience, your best practices. All the participants are also, you're most welcome to share your experience, share your thoughts, ask your questions, clarification. So when we finish, the 12th session or 11th session, so you all get an opportunity to examine yourself also, because these sessions are prepared in that way. comprehensive pre-test, we have a post-test, the evaluation is there, there's a certification. So I would like to request everybody to take this program in a bit serious way, come, understand, learn, and, enjoy the knowledge and the benefits which you are getting by the organization. So thank you everyone for the patient listening. I wish everyone happy learning and that learning journey ahead. Thank you so much, ma'am. Back to you, Yogesh.
Thank you so much, ma'am. Thank you for your valuable and very inspiring words and for your best wishes for this training program. And we are very much grateful to you for making time for all of us from your wrapped up schedule. Now, I would like to welcome and introduce Dr. Mrs. Nilima Bhore, Dean, Faculty of Nursing and Principal, BVDU College of Nursing, Sangli. She is a woman of virtue and simplicity, and I feel elated to introduce her to everyone today. She holds PhD in nursing and has a vast professional experience of 39 years in various nursing fields that includes bedside nursing, teaching UG, PG, and PhD scholars, administration and dean, Faculty of Nursing at university, has attended numerous national and international conferences, workshops, and training, and was an organizing chairperson and resource person for conference. Moreover, granted patent on 14th April 2024. In addition to this, has received Asian Best Teacher Award by EduWed Foundation of Academics and Research, CPHR Excellence Award 2023 for Excellence in Human Resource Development by CPHR Services, was a guest of honor at international conference organized by Eudoxia Research University, Newcastle, USA, and Eudoxia Research Center, India on 11th December 2023. Furthermore, participated in faculty exchange program at Sweden, done publications in national and international journals, guided 10 PhD scholars to successfully complete their PhD and currently guiding 7 PhD scholars. Besides this, she is an advisory board member for 10 journals and institutional ethics committee member for 5 universities. We are privileged to have you today with us, ma'am, and I request you to kindly give a keynote address about the Diabetes Educator Program for Nurses. Over to you.
Thank you. The introduction was too elaborative.
It had to be, ma'am.
It was not necessary. But anyway, thank you so much. At the outset, I want to thank Eco India and especially Mr. Albin and Anila ma'am. I think this is the new beginning for my college because this is the first time we are holding a training program for the nurses, and that too online. So I just would like to thank Eco India and the whole team for this opportunity that you have given to us to train our nurses. And as Anila ma'am has already said that how much important it is for us as nurses, because diabetes is one problem which is very, very common. It's increasing, and nurses play a very, very important role, not only in imparting care, but in promoting health by empowering the patients for self-care management. And there are many other aspects where a nurse can play very important role, especially in diabetic care. But I'm very happy that the clinical nurses who are working at the bedside will be trained. And I think most of the time, the concept is that we can only give care at the bedside. But through these sessions, I'm very sure you will understand that how many career opportunities are available for you to work in this area. So I hope that you will get motivated during the training sessions, and you will understand that a role of nurse is not only to give bedside care, but it is much more than that. She can be a counselor, as already Anila ma'am has said. She can be educator. She can even work independently, because nowadays a concept of independent nurse practitioner is very much coming up. So she can even play that role of a practitioner. So hope that you will get adequate knowledge. You will get motivated during these sessions. You will grow not only in knowledge, but you will also grow in your relationships with one another, as ma'am has already said, that this platform will give you opportunity to interact with one another, to motivate one another, and to grow together as a team. So that's all from my side. Hope you will enjoy this training. And I want to congratulate Dr. Pravin Dani, um, Vice Principal of this college, and the head of the Department of Medical Surgical Nursing team, and all his team members who have taken great effort in organizing these sessions. So once again, thanks ECO India, and I hope this association will continue in future, and we will grow together to bring changes in nursing, especially for India. Thank you so much.
Thank you so much, ma'am, for your valuable words. And thank you for giving us your valuable time and also best wishes for this training program. Now, I would like to share a few objectives of this training program. The first objective was to understand the basics of diabetes, types of diabetes and their symptoms, then to have a brief understanding of different treatment modalities of diabetes management, to have brief understanding of insulin in management of diabetes, to understand the complications of diabetes and its management, to understand and evaluate dietary habits and the process of monitoring the diet of a person with diabetes, and to discuss the health benefits of physical activity and awareness about correct use of different exercise modalities. So these are the objectives of the training program. Now, it's time for the pre-test, and we will allot 10 minutes for all the candidates to give the pre-test. The link will be shared to all of you, and the time will be given to you. And after 10 minutes, we can again come back and join the session. Thank you.
Participants, just to add, the link will be received on your registered email, SMS, and WhatsApp. Please check. Once the link is sent from here, it will be received on your registered number only. And if anyone received the link, please let us know in the chat box, like if you have received or not. The link has been shared. Thank you.
So simultaneously they will be able to answer pre-test. It will
Yes.
continue.
Yes.
Okay.
Okay, sir. Okay.
It may continue till session last also.
Okay,
At the
sir.
end of session also.
So the participants can give the pre-test till the end of the session. And it is compulsory to everyone to give the pre-test, please. Once again, a heartfelt welcome to everyone, and we are ready to kickstart with our session. Now, I would like to introduce you all to the course coordinator and speaker of today's first session, Dr. Pravin Dani, Professor cum Vice Principal, BBDU College of Nursing, Sangli. He has completed his PhD nursing in January 2019, has also worked as a staff nurse educator for 2 years, and has 18 years of teaching experience. Furthermore, has participated as delegate, resource person, organizing secretary for various national and international conferences and workshops, and has done 23 publications in national and international journals. Moreover, he represented Bharati Vidyapit Pune, India at Maladilin Health University, Vasteras, Sweden, within joint Linnaeus Palm Faculty Exchange Program in the year 2019. We welcome you, sir, and request you to start with your didactic presentation on basics of diabetes. Over to you, sir.
Thank you, Nikita, for that brief introduction. Let me share my screen first. And thank you, Eco India, also for giving this opportunity to educate, especially nurses, those who are working as a diabetes educator. Am I audible?
Yes, sir. You're audible, sir.
Yes, sir. Yes, sir.
Let me share my screen. Is it visible?
Sir, please put it in the slide share. Yeah,
Yes, yes.
it's visible, sir.
Now,
Yes, it's visible, sir.
Yes.
You can start.
okay, okay. These slides are moving.
Yes, sir.
Yes, yes. Okay. So basically, this is introductory part. So I'll be dealing with basics of diabetes. Main objective of this session, this is very first session. So main objective of this session is to understand. At the end of this session, the participant should understand the basics of diabetes and understand the major types of diabetes and their symptoms. Third main objective is to understand the diagnostic test for diabetes. They must be knowing this, but still, I would like to review few things. And last objective is that they should be able to impart basic information on diabetes to the patients, because that is what is expected, and that is the main objective of this program. So they should be a diabetes educator to the patients. So this is the main objective of this session. Now, what is the role of diabetes educator? As like we are discussing that nurses can work as diabetes educator, the main role is what they should answer the patient queries related to diabetes, not in detail like doctors, but at least they should be able to help patients, like to solve their queries, what to do next. They can refer patients to proper experts. Now help the patient understand his or her problem in better manner. Main role is like importance of maintaining blood sugar levels, because doctors don't have time, so they can really interact with nurse, and then why it is important to maintain blood sugar levels within normal limit, and importance of monitoring regularly. That is their role, and they should able to like function that role. Now we'll start with the basic things. What is nutritional requirement? Now to deal with basic things, nutritional requirements of human body. Nutrition is the process of consuming, because whatever like diabetes what is going to discuss, it is mainly the sugar levels, and it mainly depends on the nutritional requirements. So nutrition is what? It is nothing but the process of consuming, absorbing, and using nutrients needed by the body, growth and development of maintenance life. So to receive adequate, appropriate nutrition, people need to consume healthy diet, consist variety of nutrients. Let me see is whether I can minimize this video. Okay. Now to receive adequate, appropriate nutrition, patients, people, okay, they need to consume healthy diet which consists of variety of nutrients. If you see, like basically because of nutrition, there are two things can happen: either overnutrition or undernutrition. Now, too much nutrition can lead to obesity, and that can be harmful. Undernutrition is less nutrition, and that can result in nutritional deficiencies, for example, anemia. Now, what are the types of nutrients? Basically, it can be micronutrients and micronutrients. Macro means what? It is the large, okay, required in daily large quantities. This mainly includes proteins, fats, carbohydrates, and some minerals and water. Micronutrients are mainly they required in very small quantities, maybe in milligrams or to micrograms also. Now, this includes basically vitamins and certain minerals. Okay, even some micronutrients they enable the body to use macronutrients also. Now, what happens when the food is consumed? Why I'm dealing with these things? Because it is very important. Nurses really they need to understand what is the educator role. So we have to really educate people also. Now, when people eat food containing carbohydrate, basically these principal nutrients, carbohydrates, the digestive system breaks them down into the digestible ones, into sugar. Ultimately, it gets converted into sugar. That is called as glucose, which enters the blood. Now, this glucose, with the help of blood, is transported to all the tissues of the body, which in turn it is utilized by the body tissues as an energy source for their normal functioning. Because ultimately, glucose is utilized for energy purposes. Now, glucose utilization. How this glucose is utilized in the body? Basically, glucose enters into the blood. There are three sources. One source is carbohydrate containing food, that is grains, fruits, milk, sweets. And that source of glucose is breakdown of complex glucose stored in the glucose. stored in the liver in the form of glycogen. That is broken down. And the third thing is new synthesis of glucose in the liver. Okay, in order to utilize that glucose entering the blood is utilized, a hormone called as insulin is required. So basically, insulin is required to utilize the glucose. Now, what is the physiology of glucose absorption? It is very basic and all of you know. It is you eat food with carbohydrates, grains, fruit, milk, and sweets. And then carbohydrates changes to sugar after digestion. And the glucose enters the blood to all parts of the body and for energy purposes. The pancreas senses the rise in the blood sugar, so it makes insulin. So that is sensed by the pancreas, and then the insulin, the hormone is secreted, which in turn helps the sugar to get into the cells in your body so that it can be used as energy purpose. Now, what is insulin and pancreas? Am I audible?
Yes, sir.
Yes, sir.
Okay. Now, insulin and pancreas. Pancreas is, all of you know, it is situated in the abdomen, behind the stomach and duodenum. You can see in the pictures also. Here there is a duodenum, here pancreas, and you have spleen here. Now, pancreas, why it is important? They play a very important role in glucose metabolism. Beta cells, especially from islets of Langerhans, secrete insulin hormone. Okay, and the maintenance of blood glucose levels. Mainly when blood glucose increases, insulin is released because it is sensed by the pancreas and the insulin is released. Now, excess glucose is stored as glycogen. Whenever there is increased blood glucose level in the blood, okay, the excess glucose is stored as glycogen in the liver. It improves utilization of glucose in the body by opening the channels in the cell membrane. Again, the cell membranes also start utilizing it. When the blood glucose levels falls, okay, too low, then glucagon is again released. Glucagon, again, it is a hormone, okay, similar like insulin, but it has opposite reaction. It mainly prevents hypoglycemia. When blood glucose levels falls too low, the glucagon is released and it starts uh, glycogen, whatever glycogen is stored in the glucose, okay, into the form of glucose, it is released. So it prevents hypoglycemia, glucagon, whereas insulin prevents hyperglycemia, basically. Insulin and glucose disposal in normal individuals. If you see, look at this picture, it is a normal individual. Decreased glucose, just how I discussed, insulin is increased. Gluconeogenesis, gluconeolysis, and glycogen synthesis. These things will happen. Okay, when there is decreased sugar level, glycogen synthesis will happen, and the person will have glucose intake is increased. In that way, it can maintain a normal blood glucose levels. What happens when glucose level is increased in normal individuals? Okay, so when the glucose level is increased, it is stored in the form of glycogen. That is again a stored form of glucose name. Then increased lipolysis and glycogenolysis is increased. Now, what is diabetes? So far, we have just reviewed what is the physiology behind it. We'll come to the main part. What is diabetes? Are you all with me? I can see 42 participants now.
Yes, sir.
Okay. Now, diabetes mellitus is persistent, long-standing disease where utilization of carbohydrates, fats, and proteins by the body is disturbed, leading to high blood glucose levels, or it is also called as hyperglycemia. Now, this occurs due to, there are mainly three things why the hyperglycemia occurs. The inability of the body to produce enough insulin due to decreased functioning of beta cells in the pancreas. First thing, the insulin is not produced. Then the inability of the body to use insulin effectively. Means what? First, it occurs because insulin is not produced. And then second is, body is not able to use insulin effectively. That is called as insulin resistance. And third thing, both the things can happen. The third cause. And the hyperglycemia is singular constant feature of all types of diabetes. If you say diabetes, hyperglycemia is the constant feature. Let it be type 1 diabetes, type 2, or gestational diabetes. That's what we're going to see next slide. What is the type of diabetes? Okay, basically, if you see, there are three types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes is like it is rare, you can say 5 to 10% population only is diabetic population of type 1, whereas type 2 is more prevalent. Okay, if you see, it is 90 to 95 percentage of type 2 diabetes patients are there, and gestational diabetes. We'll see one by one. Type 1 diabetes is actually due to beta cell destruction, usually leading to absolute insulin deficiency. There is no production of insulin. That is why it is also called as insulin dependent diabetes. Type 2 diabetes is due to progressive insulin secretory defect on the background of insulin resistance. So here insulin is produced, but there is insulin resistance. Body is not able to utilize insulin properly. And third is gestational diabetes. It is diagnosed as the second or third trimester of pregnancy. Basically in the second and third trimester. What happens in type 1 diabetes? You see, this picture will tell you. You can see here it is normal situation, pancreas. We have seen that also earlier. Pancreas secrete insulin, then it gets into the cells. Insulin tries to control the blood, increase blood sugar levels. Normal individuals, glucagon also has effect. But whereas in type 1 diabetes, what happens? Insulin secretion is hampered. There is no secretion of insulin. So there is no control in the cells and the hyperglycemia occurs. So it is insulin dependent. And here in these patients, you have to give insulin. There is no other treatment choice. You have to have insulin in such patients. Type 2 diabetes, whereas in normal, you have insulin. You can see the upper picture is for normal situation. The glucose is utilized. And then type 2 diabetes, if you see, the insulin is secreted, but there is some resistance. Okay, so that is why there is hyperglycemia. Either insulin is secreted, it is not insufficient or it is not reliable to control the sugar levels, or body is not able to utilize it properly. It can be both reasons. That is in type 2 diabetes. Now, the third, gestational diabetes mellitus. It is gestational diabetes occurs during pregnancy. Women with history of gestational diabetes are at high risk of developing future diabetes also. And the prevalence is also 3 to 7% of pregnancies. If you see gestational diabetes, high blood glucose levels in the mothers, and that extra glucose is also carried to the babies, and baby can be overweight babies. Now, what is the role of insulin resistance and beta cells dysfunction in type 2 diabetes? Basically, in type 1, we have seen it is an insulin dependent, but type 2 diabetes, we have to more focus because here in next slide, we'll be talking about why it is important. So here, the role of insulin resistance and beta cells, it's mainly progressive decline in pancreatic islets function. So there is progressive decline. It will not happen suddenly. Diminished tissue response to the insulin also leads to the peripheral insulin resistance. First thing, because of progressive decline, it will lead to decrease in insulin secretion and inadequately suppressed glucagon. And both of this will lead to hyperglycemia. Causes of diabetes. Ominous octet, you can say it is. Ominous octet is nothing but the series of events what will happen if the hyperglycemia is persistently there in the patient. Now, hyperglycemia mainly occurs because of decreased insulin secretion, destruction in islets of cells, increased glucagon secretion, increased hepatic glucose production, neurotransmitter function also get disturbed, decreased glucose uptake means what? The cells will not be able to utilize the glucose BSL properly. So it remains stagnant in the blood levels. So the retention in blood levels is increased because of glucose uptake is decreased by the cells. Next is increased glucose reabsorption. Again, whatever glucose is exerted, it is reabsorbed. That also can lead to hyperglycemia. Increased lipolysis, a decreased incretin effect. Incretin effect is basically when you eat something in order to in that there is a metabolic response. Okay, the hormones they increase to stabilize the sugar levels. So that incretin effect is decreased. That is why the hyperglycemia also occurs. So these are basically causes of diabetes. You see the non-modifiable risk factors for type 2 diabetes. As there is like lot of prevalence of type 2 diabetes. Non-modifiable risk factors, the age more than 40. The moment you are more than 40, you are at risk of developing type 2 diabetes. First degree relative with diabetes, either of parent, either father, mother is diagnosed with diabetes. That is a risk. Ethnicity. Okay, the from where like location you are, like either China, America, Pakistan, India. Okay, that group is more like you can say risk at developing diabetes. History of gestational diabetes, history of impaired glucose tolerance, impaired fasting glucose, dietary heavy, like delivery of heavy weight babies, polycystic ovary syndrome, even that can be a non-modifiable risk factor, and they are at risk of developing type 2 diabetes. Acanthosis nigricans, that is a skin disorder. We can see in the picture, it's a skin disease. Even those who are having this skin problem, they can are at risk of developing type 2 diabetes. Then important thing is hypertension. Even hypertensive patients can develop diabetes. And dyslipidemia. Dyslipidemia is actually cholesterol levels, increased cholesterol levels. We have seen non-modifiable risk factors, and modifiable risk factors are what are type 2 diabetes are dietary factors. Okay, definitely you can modify these factors and control or prevent into like diabetes. So dietary factors in abdominal obesity, overweight, and physical inactivity. These are modifiable risk factors for type 2 diabetes. Till now it is clear? Am I clear so far?
Yes, sir.
Okay. If you have any doubt in between, you can interrupt and then ask me to explain. Now we'll see what are the classical symptoms of diabetes. You must have heard this many times. 3 P's: polyuria, polydipsia, and polyphagia. Polyuria is frequent urination. Okay, patient will have frequent urination, excessive thirst, polydipsia, and extreme hunger, polyphagia. Now, other symptoms of diabetes, apart from these 3 classical P's, patient also will have other symptoms like weight loss. Unintentional weight loss also is one of the symptoms. Extreme fatigue, patients will have extreme fatigue. Frequent infections because there is constant increase in blood glucose levels. Frequent infections, slow healing of wounds, because healing also gets hampered because of high sugar levels. Tingling or numbness in the hands and feet, and blurred vision. These are other symptoms. Then why should diabetes be treated? Now, diabetes should be treated very promptly because sustained high blood glucose sugar levels can cause damage to other organs, especially eyes, kidneys, nerves, heart, and blood vessels. Patients mainly of diabetes, they will die with the complications, not with the diabetes. Okay, and this will have very bad effect on other organs, like especially kidneys. I have seen patients landing up into the kidney failure at the age of 40, 45 because of uncontrolled sugar levels. Okay, so you have to have very, very keen interest in controlling blood sugar levels. And you have to make them aware. Main problem in diabetes is that people are not aware of its complications. They think that it is just one you have to take tablet and then control it. But you have to really have modifications, lifestyle modifications. So this will really lead to damage to the eyes, kidneys, nerves, hearts, and blood vessels. People of diabetes are dying with complications of blood vessels or heart attacks. They are at risk of developing hypertension, cardiovascular diseases. Now, why India has, like it is important to deal with diabetes? Because India has second highest number of people with diabetes, and very soon we will have more diabetes patients. It can be a diabetes hub in future. If you see, we are at the second number. In 2019, you can see this total 77 million patients are diagnosed with diabetes in 2019. This is just one tip of iceberg. This is just, you can say 77. You can expect more than that, double of it. And in 2030, you can have more than 100 million patients with diabetes only in India. And by the end of 2045, we say that we are going to become developed country by 2047. But With the development, we can also develop the number of diabetes patients in our nation. Okay, so this is mainly more than 150 million, means you see 15-20 crore people only with diabetes, and that is diagnosed. So the time will come, maybe in 15-20 years, we'll have each family will have at least 1 or 2 diabetes patients. So this is what is the scenario. Now, as per experts in the management of diabetes, an aspirational target is of 90-90-90 is imminently needed in India, because what is happening, most of the patients are not diagnosed, or they are diagnosed at very late. By the time they have developed some kidney failure or some damage to the organs. So basically, we have to really work on this. 90% of people with diabetes should be detected. So out of 100 diabetes patients, 90% should be detected at very early. Then only we can have some control over it. Now, at present, what is happening? We don't have even 40-50% people diagnosed with diabetes. We can have 100 patients, but only we can reach out to 30-40 for diagnosis. Now, 90% of those detected should be treated. Even if you diagnose, you should go for treatment, proper treatment, modifications. And 90% of those treated should be controlled. Now, what is happening? The moment you get diagnosed with diabetes, you think that, yes, I'll control it. You start tablets, and then still you don't do any lifestyle modifications, and they don't control. So even after diagnosis, taking proper treatment, they'll end up in various complications. So that should be controlled. Don't think that you take tablet and or insulin injection, you get cured. Or many patients, they think that I have to take it only for limited period of time. Once sugar is controlled, then I have to leave the tablets. That's not the thing. It is a lifetime management. Diagnostic criteria for diabetes is what? Now, how do you diagnose diabetes? It is mainly fasting plasma glucose. Okay, it should, if it is more than 125, 126 milligram per deciliter, or if you have 2-hour plasma glucose more than 200 milligram per deciliter during an oral glucose tolerance test, or HbA1c level more than 6.5%, or random plasma glucose level more than 200 if it is confirmed by at least 2 to 3 tests. Okay, so these are the mainly diagnostic criteria. Random plasma glucose more than 200, HbA1c levels more than 6.5, 2-hour plasma glucose more than 200, and fasting plasma more than 126. This is the main diagnostic criteria. And basically, patients should have classical symptoms of hyperglycemia. Now, understanding the diagnostics test for the diabetes. Basically, fasting plasma glucose. As a nurse, you must have come across many patients going for diagnostic test. Now, what is fasting plasma glucose? Here, we should tell them. Many patients will ask whether what should I drink. The plasma glucose level is measured after an overnight fasting of at least 8 hours. Okay, fasting postprandial plasma glucose level, it is plasma glucose is measured 2 hours after meal. Here you have to tell patient that after your lunch or breakfast, heavy breakfast, you should wait for 2 hours and then give blood for test. That is fasting postprandial glucose level. And oral glucose tolerance test is mainly fasting plasma glucose after 8 hours of fasting, and PPG 2 hours after 75 gram of glucose low. Normally, you don't go for it. You can go for fasting plasma, postprandial, and HbA1c. Now, understanding the diagnostic test for diabetes. Now, what is HbA1c? HbA1c is what? You must have heard this glycosylated hemoglobin. It is also called as HbA1c test. Now, this test is mainly glucose in the blood circulation binds irreversibly to the hemoglobin A. Hence, it is called as HbA1c. Now, what it does actually, it evaluates the average amount of glucose in the blood over previous 2 to 3 months. As red blood cells, they have lifespan of 90 days. Okay, and it binds, glucose binds. So we can have the average last 2 to 3 months, what was the average maintained by the patient. So this test is also very important, HbA1c. You can see here normal HbA1c levels, elevated HbA1c levels. Are you all with me? Participants?
Yes, sir.
Yes, sir.
What is the slide? Anybody from the participant? What is the slide about now? This slide.
What to remember?
Whether you are there or not.
What to remember before diagnostic test?
Yes, very important. So what to remember before diagnostic test? Now, as a nurse, for fasting plasma or PPG blood sugar test, you should tell that no food or drinks in the morning except water. Water is allowed, but no tea, no sharbat, no like drinks which contain sugar. Overnight fasting or at least 8 hours for fasting plasma glucose measurement next day morning. Overnight fasting is very important for 8 hours. The 2-hour post meal test is done after 2 hours of heavy breakfast or meal. No smoking, no tobacco, no exercise. Okay, or continue regular medications. Now, many of the patients they have this doubt. If I'm going to for a test, whether I should continue with diabetic medications or not, they have to continue. Continue whatever medications you have as it is, and let us see what effect it has. So you don't have to stop your medications. This is very important doubt, and patients many times they skip medications and go for test, and definitely it comes high. So for HbA1c, no fasting is required, no smoking, no tobacco, continue regular medications. Even for HbA1c also, you can continue and inform doctor if suffering from any disease of abnormal hemoglobin. Now here, HbA1c level, especially when you have some blood problems, okay, or anemia is there, it can change the results, okay, there can be artifacts. So this you cannot be reliable when you suffer from especially any blood cell disease. So you cannot rely on HbA1c levels. So that is why you should say CBC also along with this hemoglobin levels, HbA1c. What is the hemoglobin? What is RBC, WBC levels? All those things should be checked. Now, similarly, for random blood sugar testing also, no overnight or 8-hour fasting is required. It is at random you can do. Now, how will you identify high risk population for diabetes? Randomly, if you see approximately 50% of people with diabetes remain undiagnosed. Just now I was telling you this 50% of remain undiagnosed. And that is why the diabetes is called as silent disease. Why it is called as silent? Because 50% of they don't know that they are having diagnosis. They don't go for checking. Various laboratory and clinical tests are used for identification of high-risk patients. Still, people don't go for test because they know that if you go for test, definitely doctor will have something, they'll tell you. So that fear is actually very dangerous. Now, if you see the Indian diabetes risk score is one of the simple screening tool for prediction of undiagnosed diabetes developed. This IDR scale is developed by Dr. Mohan and colleagues at Madras Diabetes Research Foundation, Chennai. So this is IDR scale, and this is used overall in India also. In all diabetes education programs, we use IDR scale. This is what about IDR scale, Indian diabetic risk score. It has particulars like 4 components, especially age, abdominal obesity, physical activity, and family history. If you see, the maximum score is 100, 0, 20, 30. In each parameter, you have 30, 20, 30, 20. So maximum score is 100. If the score is more than 60, you are at very high risk of developing diabetes, or you may have diabetes also. Maybe if you screen again, it can be diagnosed as diabetes. Then, if you have 30 to 40, the risk of diabetes is moderate, and it is still recommended to have like above checkup. Even if you are at moderate risk, but still you should go for various checkings. And if it is less than 30, the risk of diabetes is probably low. Now, can diabetes be cured? very important question like no. Okay, if you think diabetes is cured, there is no cure for diabetes, but it can be controlled. Complications can be prevented. So patients, they think that if I am diagnosed with diabetes and then after taking few medications for few months, 3 4 months, if it is back to the normal levels, sugar levels, they stop medications. But again, after few months, they'll end up into problems. So diabetes is not cured. Patient can lead normal life if it is managed well, if they control blood sugar levels properly. It has been shown that with bariatric surgery, 72% of patients with type 2 diabetes mellitus have achieved near or complete normalization of blood sugar levels. Okay, that is the research going on. So bariatric surgery can make you normal blood sugar levels. That is the fat, excessive fat is removed. How can diabetes be prevented? Yes, definitely you can prevent diabetes. Diabetes can be delayed or prevented. Following simple lifestyle measures will reduce the future risk of diabetes, especially controlling weight. If you are aware at the age of 30, 35 itself, like diabetes is going to, like if you are at risk, definitely you can control the weight, get moving, do exercise, healthy dietary habits, less carbohydrate intake. Now, especially in Indian scenario, we are very fond of carbohydrate intake. We consume almost 70 to 80% of carbohydrates. Normally, it should be 40 to 50% only carbohydrates. We should eat more like proteins, fat. More protein weightage should be given. That is healthy diet. Smoking cessation, alcohol cessation, all that has to be managed. As per clinical studies, medications like metformin are known to prevent diabetes among high risk population. Even those who are having pre-diabetes, you can start uh, these medications and they can prevent you in like future complications. Just a minute. So far, any doubt?
No, sir.
No, sir.
What about hospital participants? Are they there? Total, I can see now 37 participants still. Okay. So diabetes is definitely preventable. Now here I have finished my presentation. What we'll do, I will have some case scenarios. Normally we should have case presentations, but here I have 5 case scenarios that I'm going to discuss. 2 case scenarios I'll discuss and 3 case scenarios will be discussed by Shilpa Satralkar madam. She is my colleague and her member, and she is assistant professor in medical surgical nursing. So she will be dealing with 3 case scenarios. The first 2 scenarios I'll discuss. Any doubts so far? All of you finished with pre-test?
Yes, sir.
Participants,
Yes, sir.
Yes, sir.
don't forget to submit those pre-test questions. Okay, now scenario 1. Scenario 1 is as a diabetes educator, what you will do. Okay, a high risk individual. Scenario 1 is talking about high risk individual visiting doctor along with his father who has diabetes and inquiring the doctor about his risk for getting diabetes. Now here diabetes educator to explain diabetes risk factors, symptoms and IDR scoring and refers to the doctor. This is the scenario. Here name is changed for confidentiality purposes. So Mr. Yadav, aged 42-year-old businessman, visits the doctor with his father who has diabetes. Now this person is a businessman and he visits the doctor with his father. His father is also suffering with diabetes. Now he is concerned about the risk of developing diabetes. He is overweight with a family history of diabetes and sedentary lifestyle. If you see his lifestyle also, it is not active. Sedentary lifestyle, no exercise. The doctor refers him to the diabetes educator to understand his risk. Now here the diabetes educator role comes. Diabetes educator welcomes Mr. Yadav. Good morning. How can I help you? Here Mr. Yadav tells the diabetes educator that I have positive family history of diabetes, and due to my sedentary lifestyle and weight, I am concerned about my risk of developing diabetes in the near future. Could you help me to understand my risk and factors affecting it? Now here, diabetes educator, like it is the role of diabetes educator to inform the patient. Of course, Mr. Yadav, let's first understand what diabetes is, as we have learned just now in this session. What is diabetes? Diabetes is a metabolic disorder which is either caused by deficiency of the hormone called as insulin or defect in the action, in its action. Now, this causes blood glucose levels to rise and if left uncontrolled, it can lead to serious life-threatening complications. Now, the risk factors for diabetes includes positive family history, sedentary lifestyle, increased abdominal girth, overweight, stress, and advancing age. These are the risk factors you have to tell to the person. Now, here, Mr. Yadav, what are the symptoms of diabetes? Here, the conversation between patient and the diabetes educator. Here, you can tell the patient that excessive thirst is there, frequent urination, polyuria, polydipsia, polyphagia, what we have seen. Especially at late night, you have polyuria, weight loss, itching of the skin, blurred vision, excessive hunger, urinary tract infections. However, let me tell you that the most symptom of diabetes is not a symptom. Okay, it is asymptomatic at all. Hence, it is very important to get annual checkup for diabetes. But the patient, like Mr. Yadav asked, how do I know my risk of developing IDRs? We have seen that score. What is the full form of IDRs? It is Indian Diabetes Risk Score. And it is to check the risk of diabetes, developing diabetes. Now here, if you see the patients, you can actually calculate the patient risk. Now we have seen there are 4 things: age, obesity, the lifestyle, sedentary or no exercise, and then family history. If you score the patient on these parameters, age is 42. That means patient has already crossed 40 years. We'll give the score patient 20. Abdominal obesity, patient's waist is 102 centimeters, score 20 again, because patient is obese. Especially here, you can talk about abdominal obesity. No exercise, sedentary life, score is 30. And family history, both the parents, they have a history of diabetes. That means patient is at risk of developing diabetes. The score of this patient is 90. So as IDR scale, if it is more than 60, it determines that patient is at high risk of developing diabetes. So since this patient, Mr. Yadav, the score is 90, he is at risk of developing diabetes. Since you cannot reverse the age, you have seen even the modifiable factors and not modifiable factors. Age he cannot reverse. Even he cannot do anything about his family history because his parents are already diagnosed with diabetes. Now what he can do is he need to reduce the weight, the waist circumference, and start doing some physical activity. And I hope you have, I have clarified your doubts. Suggest that you start working on your lifestyle modifications to reduce the risk of developing diabetes. And you can refer patient again to the doctor and feel free to consult me anytime. This is how the role of diabetes educator. As a nurse also, you can do this. You can very well check patient at risk and you can suggest him to go for lifestyle modifications, or even you can refer him to the expert, especially physiotherapist or some exercise dietitian can be consulted in this such case. This is one scenario. It is understood? How many of you understood scenario one, patient scenario?
Yes, sir. We understood.
Yes. And then second scenario, here the patient is diagnosed with pre-diabetes. Now here we have seen one risk. Now it is already diagnosed with pre-diabetes. Pre-diabetes means it's a phase where you are on the borderline, where to develop, you are going to develop diabetes if you don't control. Okay, he feels that he is now diabetes. Now pre-diabetes, again, it's not diabetes. Here diabetes educator explains the difference between pre-diabetes and diabetes. Okay, here a counseling goes on. Mrs. Gupta, 30-year-old lady, during her routine medical checkup, for an instance, insurance policy came to know about her sugars on paying at higher side. her fasting glucose was like 115, and post meal blood glucose level is 102. Now HbA1c level. Many times what happens, you can have postprandial hyperglycemia or fasting hyperglycemia. Now here HbA1c levels are 5.9. That means it is more than 5.7 and less than 6.5. This is a stage where the person is called as pre-diabetic stage. She is extremely stressed that she has developed diabetes and it cannot be reversed. But here diabetes educator has a role. How are you going to here she'll tell, hello Mr. Gupta, how are you doing today? What do you look so worried? Mrs. Gupta tells that I'm not doing well. Okay, you have to help me. I just discovered that I have diabetes and I'm very worried about it. Now here diabetes educators makes the person calm. Okay, show me your reports. Don't worry, Mrs. Gupta. You do not have diabetes. Pre-diabetes is not a diabetes. Okay, your blood sugar levels are deranged, indicating that you have pre-diabetes. The good news is that you can reverse it. Pre-diabetes can be reversed, and then the person becomes relaxed. Tell me how can you help and how can you reverse the pre-diabetes. Basically, the target you should have the target levels. Target fasting level should be less than 100 and post meal level should be less than 140 milligrams of deciliter. As you see in your reports, your fasting blood glucose levels are higher than your post meal blood glucose levels, indicating that you have hyperinsulinemia due to insulin resistance. Your body is producing more insulin due to increased fat levels in your body. Now, your HbA1c should be below 5.7 to be labeled as an individual with no diabetes. Okay, here you have to give confidence to the patient that it is not diabetes, and still you have chance to prevent going into diabetes. Now tell me that how can I reverse it? I will do everything to reverse it. I do not want to medications. The message that patients ask. Now here diabetes educator tells it is very simple. Lifestyle modification is a very important key. As we have seen, modifiable factors. To reverse your diabetes risk, you need to work on improving your lifestyle by eating right. So you can refer her to the dietitian, especially like how to decrease carbohydrate intake, getting adequate sleep, taking less stress, indulging in moderate physical activity. She can start with like simple brisk walking or like yoga. Moderate physical activity can be started from her side. So far we have seen two scenarios. One is at high risk and one is at pre-diabetes level. Now I ask, is there any doubt in these patient scenarios? This is how actually you must have come across. Even as a nurse also, we many times we explain to the patients that what they should do, or we refer them to the experts. Now, third scenario, I ask Mrs. Shilpa madam to take over, and there are again three scenarios, total five scenarios. Two scenarios I already dealt with. 3, 4, and 5 scenario will be taken by Mrs. Shilpa madam.
Yes, good afternoon,
Over to you,
everyone.
Shilpa madam.
Yes, sir. Thank you.
I'll change the slides from my side. You can
Yes,
continue.
sir. Okay, sir. Good afternoon, everyone. And thank you, Dr. Pravin, Dani, sir, for the brief introduction. Let's move on to scenario 3. As we all know, nurses are good educators and they're good communicators also. So when a patient with diabetes or type 2 diabetes comes to know with some queries, so we have taken some scenarios. Let us go through the scenarios. The scenario 3 is patient with high random blood sugar is referred for oral glucose tolerant test. Patient thinks that the test is unnecessary. Then here, the diabetic educator to reassure and explain diagnostic test of diabetes and importance of oral glucose tolerance test in diagnosis of diabetes. Now here, the scenario is the doctor has told the patient to undergo oral glucose tolerance test. But the patient thinks that he doesn't want this diagnostic test is unnecessary for him. And here comes the role of a diabetic educator. Now, Mr. Shah, he is 36 years old and is changing his job and has undergone his medical checkup for his new company. His RBS was found to be 160 milligram per dl, and the company physician has asked him to go through his test again after consuming oral glucose. He is not willing to do it. He is referred to the diabetic educator. Now here comes the role of a diabetic educator. Hello, Mr. Shah. Please have a seat. And how can I help you? Here, Mr. Shah says, I don't have diabetes and I don't feel any symptoms of diabetes. But this doctor of yours is insisting I take glucose, which I think is not necessary at all. He says, I may have diabetes, and then he's asking me to have 70 grams of glucose at a time. Is this how you diagnose the diabetes? The diabetes educator says, diabetes is generally asymptomatic, and hence a laboratory test is necessary to diagnose it. A fasting blood sugar or an OGTT and a HbA1c are the tests which will help you to diagnose diabetes and pre-diabetes. So here we see that diabetes is a asymptomatic disease. And here the patient comes to know only after going through a particular test. The tests are OGTT and HbA1c. So here we have to reassure the patient that he has to undergo, and it is must, and we have to convince him to undergo the test. So let us see what happens next. So can you change the slide?
Just a minute.
So here Mr. Shah says, I do not understand why the need to take glucose. Definitely a person who is not from a healthcare, he will definitely have a doubt that when he's going to do a diabetic test, before doing diabetic test, why he should take glucose. Definitely the sugar level will rise in the blood sugar test. So so, so the, yes. So here the educator says, don't worry, Mr. Shah. I will explain to you why you need to do it. Your fasting blood glucose level is in the normal range. However, your random blood glucose levels are on the higher side of normal. To rule out diabetes or pre-diabetes, it is a recommendation to challenge your beta cells, which produces insulin with 70 grams of glucose. If your levels come into the normal range, that is below 140 milligram per dl, you're safe and do not have diabetes. However, if your blood glucose levels after oral glucose tolerance test comes between 140 milligram per dl and 200 milligram per dl, it means you have pre-diabetes. Now let's see scenario 4. A person experiencing symptoms of diabetes meets a diabetic educator while traveling. So here we see they are in a travel. They are talking about traveling. So Mrs. Agarwal, she is 39 years old female, traveling to Lucknow by train, is visiting the washroom frequently. Means she is every time going to the bathroom and is drinking lot of water. She casually starts talking to the diabetic educator who is also traveling with her in her hometown. They strike a conversation. So here, the diabetic educator says, hello, where are you traveling to? And Mrs. Agarwal replies, I am going to my mom's house as she is unwell. I myself am feeling a little unwell. I am sure I am suffering from urinary tract infection, feeling very tired and thirsty all the time because I am drinking more water. I have to frequently visit the bathroom. I am worried that my urinary tract infection will get worse with the train bathroom. The diabetic educator here says, how long has it been happening to you? Has it started now or is it there for a long time? Mrs. Agarwal, no, it has just started more than a week back. But because of my mother's ill health, I could not see the doctor. So this is the scenario. The diabetic educator introduces herself and tells her that it could be diabetes. Mrs. Agarwal, she's worried now after hearing that she has diabetes. How can you say that? She says. So the diabetic educator says excessive thirst and frequent urination with tiredness is a classical symptom of diabetes. Urinary tract infection is also commonly seen in people with diabetes. So you see ants in your bathroom. Means what she is saying, diabetic educator is saying that you may be seeing some ants in the bathroom because of the sweet urine. Now here Mrs. Agarwal immediately responds in affirmative. The diabetic educator then explains the common signs and symptoms of diabetes and asks Mrs. Agarwal to meet Dr. XYZ in Lucknow immediately and get investigated. So these were the scenarios. Let's see scenario 5. Middle-aged couple having type 2 diabetes are concerned that their children may also get diabetes in future. The diabetic educator will explain that diabetes is a preventable disease and will give preventive tips. Now here Mr. and Mrs. Desai are having type 2 diabetes. Both the husband and wife have type 2 diabetes since 10 years, and they visit the doctor and meet the diabetic educator. Now they have a strong family history of diabetes. They have 2 kids who are teenagers and are overweight, and they have concern if the children will also develop diabetes in the near future. Now the diabetic educator says, "Hello, Mr. and Mrs. Desai. Long time we have not seen you." So Mr. and Mrs. Desai says, "We are doing fine and we are posted overseas for 2 years and hence could not come and see you. We are extremely worried since our kids have put on a lot of weight there. We are concerned that they should not develop diabetes. Is there a way we can know and prevent diabetes?" Here the diabetic educator says, "Of course you can. A strong family history does put you at risk for diabetes. But if you control the other risk factors, you can prevent diabetes for a long time." Mr. and Mrs. Desai, which are those and how do we prevent diabetes? The diabetic educator answers: inactivity, obesity, and adiposity, unhealthy eating, inadequate sleep, stress. These are some of the risk factors for diabetes. Maintaining an ideal body weight, waist circumference by eating right and indulging in regular physical activity can lower the risk of diabetes. Ensure that your children get adequate sleep and take out of time for physical activity. Eat healthy and lose weight. So this is the advice we were given by the diabetic educator to the husband and wife. So these were the 3 scenarios which we went through. I hope everybody has understood what the people who are not in healthcare are going through and how a health educator must educate them. So I would like to share the mic or give the mic back to Dr. Pravin sir.
Thank you, Shilpa madam.
Thank you.
Very precisely, you actually described the scenarios. And here we are at the end of today's session. Take home summary. In this session, what we have discussed is mainly the diabetes, the basics of diabetes, and then what is the educator role, nurse educator's role in diabetes. Take home summary, you can think of like the number of people with diabetes in India is rising alarmingly. So this is a serious condition now. It is really, we should be very serious about diabetes. Type 2 diabetes is one of the major types of diabetes that what we have seen. Type 2 diabetes is often characterized by insulin deficiency and insulin resistance. Now here we should mainly think of like polyuria, polydipsia, polyphagia. These are mainly 3 important signs of diabetes. Diabetes test for diabetes includes HbA1c, fasting plasma glucose levels, postprandial glucose levels, and oral glucose tolerance test. These are diagnostic tests. Then basically obesity, physical inactivity, and unhealthy diet are few risk factors for diabetes. Diabetes cannot be cured, but it can be managed and be controlled. However, it can be prevented or delayed with appropriate lifestyle modifications. So this is what is the home summary of today's session. If anybody has doubt, any like questions, you can feel free to ask me. Especially, you should think of like IDR scale, then investigations. These are very important aspects of today's session. Any doubt?
No, sir.
No, sir.
Okay. Now next session onwards, like we can have case presentation from participants. Like just now today we have discussed case scenarios. Similarly, you can take a patient for presentation and you can only one case presentation that can be for 10-15 minutes. Already templates are shared with you, and then you can prepare a PowerPoint, and that can be discussed at the end of session, speaker session. So any doubt? Over to you, Nikita now.
Sir, before Nikita ma'am takes up, just one thing I
Yes,
would
sir.
like to add. Thank you for such an elaborative, such a nice session and
Thank
nice
you, sir.
case scenarios also. But to the participants, especially when you prepare the case presentation, please don't add the names. These were shown just for an examples, and these are hypothetical cases only. So you can, sir, add on that just so that they can should not violate
Yes,
the
yes,
nature.
definitely. So it is confidential, so don't display the patient's name. Shall I stop the share now?
Yes, sir. Yes.
I can see still 33 participants. That's good achievement. Yes, Nikita madam.
Yes, sir. Yes, sir. Thank you, sir, for such an informative and educative session. We all really enjoyed the session, and it mostly helped us. We being nurses, how we can impart the basic information on diabetes to our patients, how we can conversate with them, help them sort out their queries. So that was really helpful, especially the case scenarios. They helped us to comprehend the things more clearly. So I'm really thankful to you, sir, and thank you, Shilpa ma'am. And this showed up the efforts that you both had put on into your presentation. Thank you once again. Now the platform is open for a discussion, and if any of the participants they have any kind of queries, please they can ask the questions if there are any queries or discussions to be done.
Even queries related to pre-test. Have you submitted?
Yes,
I
also
think sir
the
will tell you about
pre-test.
how
I
many of
hope
them have
all the
submitted.
participants.
I don't know.
Yes, I hope all the participants have submitted the pre-test. If anybody has not done, please do it quickly, as we are going to end up with our session. So I hope.
And tell about next session also. Next session is on 26th.
Yes, sir. Yes, sir. Yes, sir. So shall we wind up with our session, sir?
Yes, yes, we can make.
Okay. So our next training program, it is scheduled on 26th of April from 2 to 3:30 p.m. Where we will discuss about medical management of diabetes. So any changes in our schedule due to some unavoidable reasons, it will be informed to all the participants beforehand. So I once again thank Dr. Pravin Dani sir and Mr. Albin Matthew from Eco India and all the co-hosts, all the participants for being a part of this training program. Once again, thank you so much. Have a good day.
Special thanks to all the team members from medical surgical department.
Thank you, sir.
Vishal sir for handling technical things. Thank you, Vishal, and Albin sir also, because you helped us how to conduct sessions. And definitely we'll go ahead with many more
Alvin sir.
successful sessions.
Sir has cleared.
Thank you so much. It's a collective effort. Definitely, I made so much of calls and things for you. So I hope this programs do wonder. And requesting all the participants only one thing to make this an interactive session. This is not a training platform; it's a learning platform. It's a two-way learning. And no matter if you are saying anything wrong, we are not here to judge you, but we are here to give you the best advices, best practices that we can follow. Thank you.
Thank you.
Yeah, the feedback link is shared in the chat box. I request all the participants to kindly fill up these feedback questions. It's very much important to us. Thank you.